Thank you, Shani. I am a child life specialist who, along with Missy Hicks, saw a gap in services and began a community-based nonprofit. We were both child life specialists working in pediatric oncology, Missy in Atlanta and me in Austin. For me, with our children's hospital at the time located next to our children's hospital, I was occasionally called over to consult on the adult oncology floor by a worried nurse or social worker when a young parent was about to die. I became concerned with the limited knowledge the children of these adult patients had of what was happening to their parent and wondered what the child and parent had thought in the months or even years leading up to this final phase of the illness. Eventually, I was told my time needed to stay at the children's hospital. When I looked into what other resources existed in the community for these children and parents, I realized there were none until after the parent had died. Fortunately, Missy relocated to Austin about this time, and she had come to this same awareness. I'll make a long story short and say we put our heads together and decided to start Wonders and Worries. The name is all Missy's. Children wonder about illness and worry what is happening to the parent. The other important point to emphasize, as mentioned in our introduction, is the assessment of skills that Missy and I made prior to starting Wonders and Worries. I like to think it was a perfect combination of resources and experiences. Both of us had worked in hospital settings, the more traditional role for a child life specialist, and been involved with starting programs. For me, I helped start Child Life at our children's hospital years before as a community volunteer within the Junior League. And later, when pediatric oncology was begun at our children's hospital, I was hired as the first pediatric oncology child life specialist. As a result, I was involved with everything from space design to program implementation. Missy's vast experiences speak for themselves, both in amazing healthcare settings and within our Child Life Council. Together, we had the advantage of Missy knowing many people well across the country and me knowing the Austin community extensively. Missy relocated early in 2003, and I stayed in the executive director role until this beginning of this year when I stepped into one of our founder roles, focusing on expansion and our strategic plan. At Wonders and Worries, we do nurture hope and foster resiliency for children and parents in the midst of parental illness. We believe that the Child Life program we offer provides a foundation for this challenge and then translates to other challenges life brings to all of us down the road. I like being at this point in our history where we see families and children that we served years ago continuing to thrive. One of the most common things we hear is that the coping skills we teach our children and teens in our programming serve them so well in the midst of their final exams. Many parents will say that they overhear their children or teens telling their friends coping skills for that very difficult point in their school year. At Wonders and Worries, we teach parents how to parent and kids how to cope. I'm going to interject here that in my segment of this presentation, I'm going to intersperse comments about the challenges we face and the resources we use to overcome these throughout my presentation rather than citing them at the end. And of course, I'll be available along with Shani and Courtney for questions at the end of this webinar. This may look like a simple mission statement. It was not what Missy and I first started out with, but represents recently 2 years of hard work, both to get the funding to hire a professional marketing firm and then the process of messaging. As noted earlier, what we may think is a clear message from our professional child life perspective may not translate into something the general public can understand. There's an important line, too, between simply using the messaging that a marketing team thinks will appeal to the public and what we as child life specialists know is staying within our professional boundaries to represent us correctly. And I will put in a small plug, as Shani just mentioned, for the newly formed community-based non-traditional role committee. As our work emerges, we hope to be able to offer guidance in areas such as this to others in non-traditional roles. Going back to Wonders and Worries services, There is a growing body of research demonstrating the impact of parental illness on children and teens. I think most of us as child life specialists are aware that a parent's illness can have a negative impact on their children. Children may withdraw, they can become anxious or depressed, or even there's a growing body of evidence suggesting that children who have a parent with cancer develop PTSD symptoms. Some research is indicating that these children may actually have a higher level of PTSD than children who witness a sudden tragic death of a parent. Young children who have a parent with cancer, and teens as well, are 5 to 6 times more likely to be at risk for mental health issues. Children may misperceive their ill parents' behavior, as we know, as something that they did, that they caused, or may be at fault. School performance can also be seriously impacted. All of the references for these can be found at the end of our presentation. This drawing is from a teen working on the mind-body connection and reflects some of the foundations of our programming. We have a 6-session illness education curriculum that is copyrighted that is the cornerstone of all of our programming. We like to think that within this series of sessions, teaching children age-appropriate understanding of illness, treatment, and side effects, as well as facilitating communication of feelings related to the changes in the family, and helping children to identify individual coping skills to help them overcome feelings of stress, sadness, or anger. We are giving those tools to the children and the families to allow them to cope well with the illness and treatment. I'll go back to a little bit more around our programming options in just a minute. But I do want to note that our services are without charge to our families. A serious illness within the family creates a financial uncertainty for all families. We believe in our services so much, we do not want any family to have to choose if they can afford to get support for their child. We receive no government funding. Raising funds is one of the biggest challenges we have. It is also where many new skills have come into play for me. I have learned a great deal about fundraising in all regards, from grant writing to special events and even major gift asks. I will note that another challenge for us is having bilingual child life staff members, and I seriously regret that I am not fluent in Spanish. We do have 4 locations in the Austin area and just opened a new office in San Antonio in conjunction with the Children's Bereavement Center of South Texas and the START Oncology Treatment Center. This is a creative new partnership that is part of our strategic plan for expansion. This highlights various services that we do offer. We have individual sessions for children 2 to 18, group sessions, parent consultations, as well as parenting classes, family fun events, and bereavement support. And I'll highlight these in a little bit more detail in a moment. But I do want to focus on this slide, which highlights some of the common questions that I believe the general population still questions about child life and child life specialists. We consider our work preventative to help children and teens cope before there is a serious problem. But for us at Wonders and Worries, trying to get people, the public, to understand that you do not need to be in a final phase of your illness to reach out to Wonders and Worries has been challenging. We've been very fortunate in the last year to have a communications director come on board who has helped us a great deal with our messaging. Also, obstacles for parents diagnosed with a serious illness are also very overwhelming for them to be able to find time in their now even busier schedule for their children to be seen by a child life specialist. Add to this being underserved, which about 35% of our client families are, with the additional barriers of potentially accessing services due to a lack of transportation or less flexible work schedules, and as noted earlier, a language barrier. It creates a great deal of challenges for us. We do go out into the community to provide support. In situations where necessary, we can partner with schools to be available there. We have adapted our programming to be open on Saturdays. to allow more families to access our services at times where there's less traffic. So we are excited about some of the challenges that we have been able to overcome. I did want to point out that about 80% of our client families have a cancer diagnosis, while the other 20% have other serious physical illnesses. Focusing on our programming, we do provide individual sessions for children 2 to 18, focusing on our illness education curriculum as the cornerstone. Each of our individual interactions with families is highly personalized. We are able to meet the unique needs of that family, not only where they are in their illness journey, but if their child has a special need, whether they're on the autism spectrum or potentially have a hearing impairment, we can provide support for those families as well. As many of us recognize, it's invaluable when children can be in a group session. And we do provide groups for children 5 to 18. As we know, that allows for them to connect with other children or teens going through similar situations. One of my favorite quotes comes from a young girl in this picture. She is 10 years old, reflecting back on her experience when she was 7, and says, "Wonders and worries helped me because I could talk to other kids that were going through the same thing I was. And it helped me understand what my mom was going through. I tried to talk to my friends, but they didn't understand." As I said, we provide parent consultation really from the moment the referral comes to us. But we also offer parent classes. About 3 times a year, we will have a series of parenting classes. And this we've found valuable for parents, ideally at the end of treatment, to allow them to reconnect with their children, or after the death of a parent, the single caregiver finds the classes immediately incredibly valuable to bond, connect with other parents who have gone through similar things, and just to help reestablish boundaries and communication within the home. Also, we offer family fun events. These happen about 4 times a year, everything from a festival to an ice cream social. The way these came about was from the very beginning. When Missy and I would have a group session, we would, at the beginning, ask kiddos to tell us something fun that they did with their family. We were met with silence and blank stares. It became apparent to us that when a parent is going through a serious illness, the time, energy, and family resources to plan something special for the family, something fun, just wasn't there. So we created these opportunities, of course with the goal for families to have fun together. But the underlying therapeutic reasoning is that it allows our Child Life staff to reconnect with families. Families may re-access services at Wonders and Worries at any time if an illness shifts or changes, if the child in a new developmental phase relooks at what the family has been through. It also allowed us, with the family fun events, for families to connect with each other and gain that same wonderful richness of being with families, listening to how they maybe have coped or identified a way to provide a meal when they're on the go. Lots of valuable things have come about with our family fun activities. And our bereavement support. We have always been in the situation where families may be approaching the loss of a parent and preparing the children and the parents for this. As Child Life specialists, I think we have a unique opportunity that many people do not. In fact, I was told by a parent who worked for a hospice here in town, who was a client of Wonders and Worries, that as her husband, father to her middle school daughter, was approaching the end of his life, the family session with our Child Life specialist, the questions that she helped the mother think through, asking her daughter if she wanted to have the opportunity to say goodbye to her father. What if the death happened while she was at school? Provided invaluable opportunities that she would not have thought of on her own. Besides focusing on anticipatory grieving and memory making, We do continue to see families after the loss has occurred. This was not initially the case when we started Wonders and Worries. We intended to have our families transition to the other bereavement centers already existing in Austin. But what we found after a couple of years was that the families that connected with us during the illness phase did not make that transition. So we now provide bereavement support. And it's been a wonderful opportunity for some of our middle school and teens to interact with other teens who potentially are facing the loss of a parent. I like having this slide here because it also shows the complexities of working in a community nonprofit where funds need to be raised too, and the ethical awarenesses that go into this. Thinking through how to create awareness with our client families of the need for funding and the fact that most people, donors, connect through a story of an actual client family rather than simply numbers has required much thought and has been a growing process for us. Learning how to create information for families on how funds are raised, finding the opportunity to ask if they would be willing to share their story has been crucial. This mom and her husband shared their story with Wonders and Worries and the community, and later became the chairs of our Unmasked Gala. Their daughter Reese, pictured in this picture, is the little girl who shared her testimony about the group support as well. You can find more of our family stories on our website. I did want to include this here because, as this dad states, I think many parents wonder, how can I talk to my child? How can I tell them about my cancer diagnosis? We do have a tip sheet on our website that help parents step through this, and I wanted to make sure that you knew of this resource. And finally, this family story is also on our website and shares a little bit around the ability of children, as we know as child life specialists, to grasp complex medical situations given the right information and through the child life perspective. I'm proud that often parents will tell us that when a physician walks in their hospital room or treatment room, if their child is there, their physician is impressed with the amount of knowledge and the level of questioning that the child will ask the physician. This represents the growth of Wonders and Worries. In 16 years this month, Wonders and Worries has grown to serve more than 6,500 children and parents. We have gone from 2 employees, Missy and me, to 16, and from a very simple budget of $120,000 a year to over $1 million annual budget. Practicum students have been a part of our programming for 10 years, and we're proud to partner with the UT School of Social Work for program evaluation. We are currently conducting a randomized clinical trial of our illness education curriculum. I hope that this overview has given some insight into how an idea, started by 2 child life specialists, can grow over time. Missy and I are excited about the new strategic plan that offers more growth and expansion for Wonders and Worries.